Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does tramadol withdrawal last? Symptoms of tramadol withdrawal can start 8 to 24 hours after the last dose. Untreated, withdrawal symptoms usually last for 4 to 10 days. Tramadol withdrawal is caused by stopping the drug suddenly. The severity of withdrawal may depend on the dose you are taking, whether you are physically dependent on it. Being physically dependent on a drug means you need to take it to prevent unpleasant symptoms. The time it takes to develop physical dependence varies, depending on the dosage and the person. Tramadol is a synthetic opioid drug. Withdrawal from tramadol and other opioids can be very uncomfortable. Tapering off tramadol can prevent withdrawal. Withdrawal symptoms may be relieved by restarting opioid therapy and then gradually reducing the dose, or tapering. This is done under a doctor's supervision. Withdrawal symptoms. Symptoms of tramadol withdrawal often resemble the flu and are usually similar to symptoms of withdrawal from other opioid drugs and some antidepressants. Symptoms of tramadol withdrawal may include restlessness, drug craving, anxiety, sweating, insomnia, rigors, pain, nausea, tremors, diarrhea, upper respiratory symptoms, goosebumps. Most tramadol withdrawal cases are marked by flu-like symptoms, restlessness, drug craving. These types of symptoms make up about 90% of cases of tramadol withdrawal. Rarer withdrawal symptoms can occur in about 10% of cases and include hallucinations, paranoia, extreme anxiety, panic attacks, confusion, numbness and tingling in the extremities. Easing withdrawal symptoms. Tapering can prevent or minimize symptoms of withdrawal. There is no standard schedule for tapering off tramadol or other opioids, so work with your doctor to come up with an individualized plan. You may be able to taper off tramadol more quickly if you have been taking the drug for a shorter period of time. Someone who has taken tramadol for a longer period of time may not tolerate a short taper as well. When creating a tapering schedule, some factors considered include the drug dose being taken, how long you have been taking the drug, the type of pain that's being treated, your physical and mental health. During the tapering period, you might experience increased pain or severe withdrawal symptoms as the medication is reduced. In these cases, you may need to pause the tapering schedule for the time being. Your doctor may prescribe the medication at your previous dose. Then you would start again with a slower and more gradual tapering period. Related questions: can you take tramadol with acetaminophen, ibuprofen, or aspirin? How much tramadol should I give my dog? Is tramadol stronger than codeine? Overdose. Tramadol overdose can happen if you take more than the recommended dose. Also, chewing, crushing or splitting tramadol tablets can alter the dosage and delivery, and increase the likelihood of overdose. Overdose symptoms include lethargy, nausea, tachycardia, agitation, hypertension, respiratory depression, seizures, coma. During the tapering period, you may be at increased risk of overdose if you suddenly resume taking a higher dose. Naloxone can be used to treat an opioid overdose. Tramadol dependency. Tramadol is prescribed to manage moderate to severe pain. Although tramadol is a synthetic opioid, it is considered to be weaker than other opioids, like morphine. Tramadol is approximately 6,000-fold weaker than morphine. Tramadol is thought to have a low potential for dependence, but chronic, long-term use makes dependence more likely. People with a history of substance abuse are also more likely to become dependent on tramadol. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.